Research done in the 4 divisions of Kawempe, Nakawa, Lubaga and Machindye by Makerere College of Business and Management Sciences implicated the increasing road accidents to border riders using drugs. According to the research, every 1 out of the 10 border riders were found using drugs, hence the need of sensitizing cyclists about the use of substance abuse.
This population used illicit drugs was because they wanted to work longer. They wanted to get that stamina, that strength, to enable them not to sleep or get tired, to work longer so that they are able to earn. Many of them have loans. They are working hard. They have to support their families. So a combination of that was, those two were the main reasons why this population was using drugs.
Minister of Works and Transport, Uganda Police and other stakeholders were also urged to subsidize the cost of riding permits and oversee implementation in partnership with Uganda Police Force.
The objective of government to be able to take on these findings and incorporate them into policies going forward and also actions. From this research, you find that key findings have been brought out. One of them being that many of these riders don't have driving licenses. Many of them are talking about a school for riders, issues to do with why they are taking drugs, the supply, and so on.
Equipping police and health facilities with on-spot testing equipments to conduct mandatory on-spot drug testing, especially cyclists that cause accidents, has been recommended.
During the study, we saw number of people going to Butabika increased, and we looked into the database because as we screen clients, we ask them, what is your profession, what do you do, and where are you from? So through screening of these clients, we realized that most of the clients were borders. And that's we realized that the numbers were going up. And we understood that it could be the effect of this study as it was ongoing in different study sites.
Government, particularly Uganda Police, has been urged to take lead in the intensification of measures to limit importation of illicit substances. Scaling up establishment of data on people using drugs to inform prioritization and advocacy for harm reduction interventions is important.
It is a challenge. People were scared and didn't know what the content of the oral swab was. There were concerns about whether it was meant to infect them with COVID. But of course, with the explanations and showing them what it was, some of them would finally accept to be part of the study through testing.
The public has been urged to adopt a community-based approach aimed at preventing illicit drug use and rehabilitation of users through engagement. Sudat Kaye, Zahara Abigaba, UBC.